Vata, Pitta, and Kapha have different response to salt intake. Vata people who tend to be dry and cold may benefit from moderate salt intake to improve digestion and improve dryness. Pitta who are prone to heat and inflammation should use salt sparingly to avoid aggravation. Kapha who tend to be heavy and have slow digestion should limit the salt intake to prevent water retention and sluggishness. The WHO has recommended a daily intake of 5 grams of salt per day per person. Salt used in home foods or cooking and consumed through homemade foods is 8 grams to 11.1 grams per person per day. Salt consumed through processed foods or restaurant foods are low in India as the processed foods industry is in its infancy stages and not fully developed, nor processed foods has gained acceptance among Indian consumers. From the study, it is evident that families under study consume packaged foods as meal accompaniment or as an evening snacks. Hence, assuming that the urban India consumers consumes on an average of 100 grams of processed or baked foods, then the daily intake of sodium will be approximately 500 milligram of sodium per person per day, which is equivalent to 1.10 grams of salt per day per person. The last source of consumption of sodium is through the naturally occurring sodium in the foods. Indians consume leafy vegetables, eggs, and various forms of dairy products such as paneer, curd, cheese, and milk, which contain the naturally occurring sodium. From the study, we can safely assume that from such foods, Indian consumers consume approximately 400 to 450 mg of sodium, which is equivalent to 900 mg of salt. Pickles have 6% of salt, bread 14%, processed meat 19%, cheese 5%, 4% in biscuits, buns, cake, pastries, etc. The bread, processed meat, cheese, and condiments often used to make sandwiches all contribute a significant amount of sodium.